Yeah, good morning. 5 minutes. We'll start now. I hope I'm audible. So, okay, guys, good morning. Let's begin the session now. So, I hope everyone am audible. Please respond. Yes, I'm audible. Yes, guys. Please respond. Hello. Yes, guys, I'm audible. Yeah. Okay, guys. Uh, Thanks for responding. So, guys, let's start here. So, before we move ahead, technically, guys, uh, let's just brush it up once. What is the things you have in the medical coding? Okay. So, guys, when we talk about the medical coding, So what do you mean by medical coding, guys? As already you know, medical coding is nothing but, guys, coding or code related to the, okay guys, code related to the, code related to the, or else let's use in this way, that will be better. So guys, what is medical? Everyone, what is medical? Medical can refer to either, this guys, medical can refer to either medical examination, medical can either refer towards it, guys, medical examination, everyone. Yeah, yes, exactly. Medical can refer either to the medical examination, exactly, medical examination, or medical treatment, guys. Medical treatment. And now, guys, what is medical examination? Yeah, what is medical examination? Medical examination are physical checkups. Yes, exactly. Exactly. So medical examination is nothing but what, guys? Physical checkups conducted by a doctor. By a doctor. Okay. So why the medical physical checks are needed, guys? Medical physical checks are needed for what? Basically, mostly now, guys, for employment, for employment. So nowadays, before we get a job, you will be like medical examinations will be conducted here, guys. Medical examination will be conducted. Then the what is the next one? You have it, guys. Okay. Uh, and also for what? Treatment. And also for treatment. Okay. And also for the medical treatment. And also for what's that? Medical treatment. Okay, for employment or for medical treatment, for employment or medical treatment. So guys, the word medical can refer either to medical examination or medical treatment, where medical examination are physical checkups conducted by a doctor for the purpose of what? Employment or medical treatment. For the purpose of what? Employment or medical treatment, guys. Okay, okay, that's it. Now the next one, guys. So why this medical examination are needed? Basically, yes guys, need of medical examination. Why this medical examination is needed, guys? The medical examination is needed for the following purpose, as already we have discussed. The first one is for what, guys? Pre-employment. Pre-employment. And the second one is what's that, guys? For insurance. And the third one is what's it, guys? Specific. Yeah, specific. Okay, guys, program or activity. Okay. Uh, some like some programs, I can say. Some programs I can say, guys, like what's it? Sports, travel. Okay. may require sports or travel. If you want to be a sportsman, or if you want to travel from one country to the another country, like we had it in COVID-19. Whenever you wanted to travel from one country to the another country, we need to have, what is it, guys? We require to have a that is nothing but medical certificate stating that you are not affected with the COVID-19. Am I right? Like the same one, okay? So may require, yes, guys, may require, what is that? Medical clearance. May require medical clearance. May require the medical clearance, guys. Okay. And the next one, the fourth one, medical examination purpose of conducting general health checkup. General health checkup, guys. Okay. So regular checkups can help detect the potential health problems in early stages. This is done for what, guys? This is whenever we use the general health checkup, it is nothing but regular checkups can help detect potential health problems in that is nothing but in near future. Okay, these are the, guys, these are the, everyone, these are the medical examinations purpose, we can say, guys. And now when it comes to this, guys, when it comes to this medical coding, coding means what, guys? What do you make coding, everyone? Yeah, guys, I want the session to be interactive, so please let me know what is a coding. Yeah, what do you make coding, guys? Yes, exactly. Yeah, yes, coding is a, yes, exactly, coding is nothing but mentioning these method of method of treatment, mentioning these method of treatments and method of treatments these method of treatments and, okay, guys, these method of treatments and, okay, diagnosis, diagnosis all, okay, diagnosis comma diseases are placed under a coded language, under a coded language. Okay, so mentioning these method of treatments and diagnosis diseases, etc., okay, guys, etc., are placed under, what's it, guys, etc., are placed under a coded language, are placed under, what's it, guys, a coded language. So in broad, I can say, guys, medical coding is nothing but, guys, what is medical coding? Medical coding is nothing but, okay, guys, medical coding is nothing but placing of, guys, placing of the method of treatments, the diagnosis, the diseases, okay, guys, all comes under, okay, all comes under what, putting them in a proper coded form. Proper coded form is nothing but called as what? Medical coding. Is called as what, guys? Medical coding. Okay, guys. And when it comes to this medical coding, guys, everyone, everyone. So what is the method of treatments you have it, guys? Medical treatments. Yes, the following are the medical treatments. The following are the medical treatments. So these medical treatments are classified into the following categories, guys. What are those categories? Can somebody tell me, please? What are those categories? Yeah. What are those categories, guys? So we can say the first category is what? Medications. Medications. The second one is what, guys? Surgery. And the third one is called as what? Therapies. Okay. And the fourth one is what is it, guys? Counseling. Okay, guys, counseling. So these are the four different type of medical treatments provided to a patient. Provided to a patient. So, and all these guys, when you talk about the medication, when you talk about the medication, or when you talk about the surgeries, whether it is a minor surgery or the major surgery, or when you talk about the therapies, or you talk about the counseling, anything, all this will be placed in a coded language. Okay, all this will be placed in a coded language. This is all is about the medical coding. So we code these medications, surgeries, therapies, and counseling in a coded language. Even guys, even when it comes to what is it, guys? Even when it comes to even when it comes to guys, even the devices which can be the external device or implant devices, all this comes under that treatment only, guys. Treatment only. Treatment. Okay, so basically all these medical codings is done for the following reasons. The medical coding is done for what's that, guys? For the following reasons. I can say reasons for which the medical codes are needed. Reasons for which medical codes are needed. What are the reasons, guys? The first one is for what is it, guys? Insurance claims. And the second one is what's it, guys? The second one is for what's it, guys? I can say for clinical study. Clinical study. Okay. Medical insurance claims, clinical study. And then what is the other purpose for which we require the medical codes, guys? Everyone? For hospitals to maintain patients data. Okay, guys, to maintain the patient's data. So these, for all these purposes, guys, we require the medical coding. And now, who does this? The medical coding, guys, the medical coding are coded by a medical coder. And now, guys, who is called as a medical coder, guys? As we know, we have two type of medical coders. One is the certified. Yes, exactly. Certified medical coder. Yes, certified medical coder. Across the globe, only certified medical coders are recognized, guys. Only across the globe, certified medical coders are recognized. Rest of them are not recognized much. Okay. So certified medical coder, and as well as we can say uncertified. Okay. Uncertified medical coder. And who is a certified medical coder, guys? A person who writes the CPC examination, which is conducted by, what is that, guys? AAPC. What is this AAPC, guys? AAPC stands for what? American Academy of Professional Coders. American Academy of the Professional Coders provides you a medical coding certificate where you need to write an examination. Uncertified means what, guys? Uncertified is nothing but experienced. Okay, guys, experienced person medical background with medical background without, guys, an uncertified medical code is nothing but experienced person with a medical background who can code them, but he is not certified. But across the globe, to get a job, to survive in the industry, one must and should have, what is it, guys? Medical coding certifications. Medical coding, what's it, guys? Certifications. Okay. So medical coding certifications. Okay. Just a minute, guys. 1 minute. I'll be back. Now, guys, so when it comes to this, what is, guys, CPC certification? Everyone, the CPC certifications, what is it? CPC certification. So, guys, certified professional coder. CPC stands for what? Certified professional coder, guys. Okay. The CPC certification validates proficiency in the correct application, of, what is it, guys? CPT, comma, what is it, guys? HCPCS. HCPCS. Okay, guys. And under this again, guys, under this again, you will have, what's it, guys? COC. COC stand for what, guys? Certified. Okay, guys, certified outpatient coding. Okay, guys. Okay, what's it, guys? COC is nothing but guys, COC is your certified outpatient coding. And then you have what's that CIC guys. What is CIC guys? Certified inpatient coding. Okay. Whereas guys, this codings, these all are the, the codes I can say is this coding includes everything, guys. Everything, every method of treatment, including the ambulance, okay, including the ambulance service, whatever you're taking up, all those includes here. Okay, what's that guys? Okay, all those, everything, that is nothing but you can say guys around, okay, surgeries, okay, and then you have what is it, anesthesia and pain management coding, okay, and oncology coding, hematology coding, all this, everything. Okay, so before all these we learn, guys, before all these we learn, first of all you have to have an overview of human anatomy. Okay guys, you need to have what's that guys, human anatomy. Okay, you need to have what's that, an overview idea of the human anatomy. So how does the whole system works, and what are the guys, you need to have an idea about the human anatomy. And then even you need to know guys, first of all, what are the types of systems we have it here guys, such as digestive system, respiratory system, and okay, what is it you have it guys, reproductive system. All these are the systems we should understand it. Okay, so first of all I'll give you an overview of the guys human anatomy, what exactly the human anatomy is. Okay, so because some of you might be from medical background and some of you might not be from medical background, but guys, whether you are from medical background or you are not from a medical background, you must and should know the basics guys. Without the basics you cannot expect to have a good career in the medical coding. So first of all guys, we will start here the process, because if I keep on telling you the rest of the things, it's not, you may not understand if you're not from the medical background. So first of all, the first topic which we are going to discuss here is the human anatomy guys. Then under the human anatomy, we will see what are all the systems you have it here. Okay, what are the systems? The human anatomy is you are into how many systems. Okay, what are the systems we have it. Then once it is done guys, then we will come to the diseases and method of treatments. And I will give you a general logbook guys, where in that particular log I will provide you through this email. Okay, all of you provide me a mail ID. I'll send you a generalized logbook which gives you the basic coding starting from A to Z guys. A to Z, every letter with A. Okay, suppose you have what is that guys, let us say A, then A, triple A, 1. This is one code guys. So for what code it is there, so you can find it out. Okay, you can just by heart it off guys, all these A to Z, you will have the codes from what is that, all A to Z. So the overview of these codings you can get it in the logbook. I'll send you one logbook as well. Okay, then we will study about the, yes guys, then we'll study about how to code all this. Suppose there is a patient, okay, who got in that is nothing but who got that is nothing but who admitted in the hospital with a treatment for the heart disease, for the treatment of what's it is, heart disease. So how to code that, we'll take examples and then I will code accordingly, and I will give you then assignments also on a daily basis, and the assignment is also on a daily basis. So based on that you write your coding and just show me off, so that if any corrections is needed or any changes is needed, I'll let you know on the same. Okay, so in this particular pattern you can be more proficient in getting the codes here easily understand. Okay guys, so these are the methods we have it guys, so we adopt it. Okay, so anyways, now in the next session we are going to start with the human anatomy guys. So first class will be on the human anatomy, and then we will move with the further process guys. Okay, and as already yesterday we have discussed guys, yesterday as already we have discussed these all things, I need not repeat it again and again guys. These are the medical treatments we have already discussed yesterday. and even the that is nothing but we can see the modules covered in this course is also discussed here. Okay, this is the modules which we cover it here, guys. Okay, and the certification coding. So you will have the first one, basic certification as a medical coder, and then you have the senior medical coder, quality analyst, team lead, and managers, and all these are the level of that is hierarchical. You will have it in this medical coding, guys. Okay, and so all this, anyways, the medical coding, all we have discussed it already. Okay, so I need not repeat it again on a daily basis. Okay, so directly we'll start with the human anatomy from the next session onwards. So for today, if you have any doubts, guys, you can just ask me. We will discuss that. Okay, because the rest of the things we will have to start with a particular subject only. Yeah. Daily lecture will be at 9 a.m. guys. Daily lecture will be at 9 a.m. 9 to 10 will be the standard. 10 means 10 to 15, it will be 10, 15 will be there. 1 hour to 1 hour 15 minutes, or sometime 9:30 or 10:30 also it will take 1 hour 15 minutes, because we have to take every day we will be discussing one system, guys. First of all, after this human anatomy, I will discuss all this in a proper form. Okay, guys. So we'll discuss what is a digestive system. One day we'll go whole for the digestive system, we'll just allocate it. Okay, so generally, guys, what happens in the market right now, they're just showing you the ppts, and with that they're giving the explanation, but I don't believe in this ppt presentations, guys. I believe to give you in a proper method of this one, guys. So ppts is only for presentation, just to have a good view on the same, but actually the subject wise, everything wise, you should understand it in a proper coding manner only. So that's the reason I don't use the ppts, guys. Rather than ppts is just a waste of time for you and as well as for me. Okay, unless until it is for presentation, because here if the presentation and all these things, it doesn't matter. But only thing is what, our main motive is to get a job, guys. That is the main motive of us. So for we will be focusing main on that, rather than wasting our time in presenting and all these things, guys. Okay, so that's the one you have it, guys. And the next sessions we will start it again. Okay, guys, from tomorrow morning. Okay, we'll start with the human anatomy. And any other questions if you have, you can just ask me now. And the contents, everything I already told you, these are the contents we are going to follow it, guys. This is the content we are going to follow it. Modules covered here: human anatomy and physiology, and ICD. Okay, 10 cm guidelines, CPT, HCPCS, PCS, and CPC examination. So you will also have many more examinations next level to the CPC, guys. But CPC is the basic. Okay, that is certified professional coder examination is the basic examination, because as you are a fresher, so once you are there in the industry for the next 1 year or 2 years, then you can appear for the next level of coding as well. You will have altogether around 5 level of codings on this, guys. Okay, so those all you can attend it by yourself, but the only first basic one, because you are not aware of all this, so you need to take the training for the CPC examination coding, guys. Okay, so once you are there in the industry, automatically you can do it. Yes. Yes, of course. So that's the one, guys. Any other questions if you have, you can ask me now. Okay. So this is a question pattern, guys. So almost all 4 questions we'll be having on the medical terminology. 4 questions we'll be having on the anatomy, and 4 questions, not exactly. This is the approximate pattern, guys, because this is an online examination and random paper will be given to everyone. There will be no fixed pattern that, but mostly, guys, but mostly this will be the pattern they will follow. Almost all 3 to 4 questions will be on human anatomy, 3 to 4 questions on the medical terminology, and 3 to 4 questions on the compliance and regulatory. Some 5 to 6 questions on the coding guidelines, 5 to 6 questions on the ICD 10 cm, and 2 to 3 questions on the HCPCS. All these are the, can you see here, guys? All these are some of the questions what we can discuss. It altogether you will have 100 questions. 100 questions paper will be there for you for a CPC examination, guys. And once you are qualified, then that means you are authorized to, guys, authorized to work as a medical coder. you're authorized to work as a medical coder, guys. Anytime you can get a things. And getting a job is not a big deal right now. If you are good enough in all the subject, if you have passed CPC on your own, then getting a job is not a difficult task, guys. You can get it. And if you're already from the medical background, you want to switch it over to this field, that is medical coding, then it will be a more added advantage for you. How? Guys, already you have it, already under the medical field, and now you wanted to shift it to this one. Then rather than a fresher, they will pay you more on this, guys. You can demand more pay on this, at least 5 to 6 lakhs per annum. You can demand it if you are already into some experienced medical this thing, rather than coding if you are into some other one also. So guys, that is one method of treatment, and that is a method of approach I can tell you. Anyways, these all things we will discuss it, how to prepare your resume, all the things once we complete the portion on this, guys. Separate 2 sessions, I'll take you on the resume planning, everything, guys. Don't worry on that. Okay. And rest of the things, guys. Yeah, please. See, age doesn't matter here. Age is not an issue. You can do it. You can do it. If you were 36 also, it's not an issue, guys. You can do it here. Okay. But subject to which you need to have a certification is mandatory. CPC certification is mandatory, guys. Make sure your main task here is to pass the CPC rather than doing anything, guys. The main task, if you are CPC certified, then definitely you will get it. That's not a problem. Okay. So that's it. So any other questions, guys? Okay, guys, that's it. Thank you, everyone. So I'm ending the session here. So tomorrow morning at 9 a.m. we'll start the session on the human anatomy, the first. Okay, thank you. And recorded sessions, everything will be provided to you on the daily basis only, guys. And these recordings will also be forwarded to you. This demo recordings, everything. So we'll start the subject from tomorrow, guys. Thank you, everyone. I'm ending the session. Bye.